Hey everyone, my guest today is Alan Graves. Alan is the CEO of DoNotAge.org, a company selling longevity supplements and tests for your body levels of those supplements. So for example, a test of your NAD level in your body. They also use a big chunk of their profits to fund research specifically for those supplements, but also for other compounds, like for example rapamycin, that they don't necessarily sell, but that have the potential to be beneficial for longevity. We talked today because he was part of the Reverse Longevity documentary, where he flew to Costa Rica with a bunch of other longevity experts, like for example Andrea Meyer, and they discussed the current state of the longevity industry. I already talked to Charles Maddox, the producer of this documentary, and he connected me with Alan. In this interview, we dive into the current state of the supplement industry, and I ask Alan about his learnings from building this company. So now, enjoy my conversation with Alan Graves. Hey Alan, how about we start by you giving us a 3-minute summary of who you are and what you're currently working on.
Alias, thank you for having me. I am Alan Graves, CEO at DoNotAge.org. We are a health research organization focused on extending healthy lifespan for as many people as possible. You could say that we do the science so that you don't have to. We offer things like testing kits and supplements and free information so that you can live healthier for longer. A little bit about my story in terms of background would be that I was always taught that aging is something that you can do nothing about. It has to happen. And unfortunately, because of some bad life choices that I made, I started to feel the effects of aging very early. So when I found out that aging is reversible, it became my main focus, and eventually DoNotAge.org was born. I remember the first scientific paper I ever read. It was extremely difficult for me to understand the language because I don't have the scientific background. And so I sort of translated that manually into layman's terms. And interestingly, that has now become a staple for DoNotAge.org members because the people that are already members will understand that they get emails that make it very easy for them to understand. Most people don't have a degree in biology, and thankfully, you don't need one to understand our emails. We try and make it sort of easily digestible so that everyone can understand.
So your main business model at DoNotAge.org is that you sell supplements and testing kits, right?
Yes, we're a health research organization, and essentially what that means is we use the profits from the goods we sell to fund further research for health and longevity. Then we use that research to offer better goods and services. And then we use the profits from that to fund more research, and so on and so forth until, we all live forever.
Yeah. Can you maybe tell us a bit about like some research that you did currently?
Somewhat, sorry?
Some research that you did recently with DoNotAge.org.
Yeah, sure. So there's lots going on. I mean, originally when we began, we only did our own research, and then things very, very quickly became far too big for us to handle. And so what we did was we then started funding other people's research as well. So now the majority of the research that we fund isn't done by our own researchers and scientists. It's done by people all around the world. They'll come to us and they'll say, we need uh, this much money or this much ingredients because we're trying to do this. We'll look at it with the scientific team, and if we think that it's going to help to advance the world of health and longevity, then we'll go ahead with it. I will dive into one of the most exciting ones and maybe one of the most pertinent ones that we're working on right now, which is we are partnering with Professor Andrea Meyer, who I know has been on your podcast.
Yes.
So our most popular supplement is called SIRT6 Activator. It's a complete breakthrough in the longevity space. The incredible results are why it's so popular. And we started out with an amazing mouse trial, then we had a human trial, and now we're doing another human trial, but this one will be completed much faster. Because we're doing it in Singapore, where it's much more conducive to do clinical trials and get things approved for human trials, whereas the FDA in America can be difficult, shall we say.
Yes.
So, yeah, what we're actually looking at in Cert6 Activator is we're taking men that are between the ages of 50 and 80, giving, obviously there's a placebo group, and then the group that's taking Cert6 Activator, they'll be taking a few of those capsules every day, and then we'll be looking at things like frailty, biological age, skin aging, muscle, body composition, cognition, and lots of other different factors in terms of healthy aging. And so, yeah, that's a really exciting one that we're working on at the moment.
Interesting. So, some question that comes up is like, how is that profitable for you? Like, you have a company, and if you spend all your profits on research, like, do you hope that by discovering new supplements you will like make more profits? Because I don't know if you have like the IP for Cert6 activators.
So we do have intellectual property for that, but I think
Okay.
we're trying to be a we're trying to change the supplement industry, and we've done, although we've made huge strides so far. If you look at the supplement industry holistically, we've got so much further to go. Now, I always say 99% of the supplement industry gives the rest a bad name,
Mm-hmm.
because the vast majority of them they spend over 50% of their revenues on marketing,
Yes.
which is just them trying to pretend to be better than the competition. And it is our opinion that that money should be spent on research, because that's what we do. And, we do a lot better than the vast majority of supplement companies out there. Granted, we're a health research organization. It's very, very different and much more difficult to set up. But we think we're trying to lead by example, because you do, not everything should always be about the bottom line. Now,
Mm-hmm.
it is my job as CEO to ensure that we still make a profit each year, because if we don't, then we'll go out of business and then there's no research.
Yes.
So I understand that side of it, but it's not about, money is infinite, right? So at what point do you go, okay, we've got enough now? Most companies don't have that point. And I think particularly with the current state of the supplement industry, it's pretty damn horrendous. I think if most people knew what I know, then there would only really be three supplement companies left in the world. They'd be very, very big companies, but there'd only be three, and the rest of them would all die out. But they fill their capsules with fillers and low quality ingredients. They don't do the manufacturing themselves most of the time. They don't ship themselves. They'll make it in an East Asian country and then claim to be made in USA or made in Germany or whatever, just because they bottled it there. Um, I think the main thing, the main problem is they don't care if the product actually works, and they just care if it sells. And the knock-on effect of this is that then consumers will go, this supplements don't work, or this product doesn't work, when actually they've just had a bad dosage or a bad quality, or they've been using the wrong ingredient completely. And this is why we do the research side, so we can go, now we know. So we already know we have millions of people taking Certix Activator every day. We already know that it has incredible effects. Now we're following up with even more research so that we can then go, look, we've proven it in a clinical trial. It improves your frailty score. It reverses your biological age, whatever it may be. Um, so yeah, I have a big bee in my bonnet about the supplement industry as a whole. I mean, it's if you look globally, it's $500 billion industry. And so if you think that 50% of revenues could be $250 billion per year,
Well,
there's a lot of zeros that could be going into research. But right now they're going to Meta and YouTube ads or whatever, for people just to say, oh, get ours instead of theirs, rather than pioneering. And I think the only way it's going to change is if consumers vote with their feet instead of choosing Amazon's choice or whatever happens to
mm-hmm.
be the cheapest. But yeah, sorry, I think I got off on a
Yeah,
on a
no,
bit of
no, no,
a
but
tangent there,
that's
because it's
that's a,
it's something I'm very passionate about.
yeah, yeah, exactly. That was what I wanted to ask you. Like, what could we do about this? Like, not only as customers, but like, what could be done about this mechanistically? Like, how would I know? Like, if you say they put on the label that it's made in Germany or made in US, but it's not actually, like, what can I do as a customer? Like, what can people do if?
There's not really much you can do because if you don't have access to the information, it's the same as people that there are the vast majority of people still think the same thing I used to think, which is that aging isn't malleable, that you just it's
Mm,
going to happen. There's nothing you can do about it. And the only way to change that is information and spreading information, hopefully doing podcasts like this one. Um, but so I think it's up to us in the industry to talk about it more. And unfortunately, because a lot of the time, because of monetary incentives, people don't want to talk about it. So, for example, influencers, if you might not make that much money on your YouTube channel or your TikTok or whatever. If a supplement company comes to you and says, "Here's $5,000, say this," a lot of people do say that.
yeah.
We're lucky; we have a lot of people saying nice things about us, but we don't pay them. We don't pay any of them. We don't believe in upfront payments because that means that we control the narrative. And we think the narrative should be based on our performance and what we do on an ongoing basis rather than tell everybody about this. Does that make sense?
Yeah, it makes sense, but like, still, like, even you, like, you can say, like, okay, we are a better supplement company, but I bet, like, the companies you are talking about, they would also, like, if I would talk to their CEO, they would also say, like, we don't use fillers, but all the others do. Like, what can consumers do to actually figure out, like, where's the high quality?
And I think that was one of the things that we came up against a few years ago was, we naively thought, well, we know we're the best, so we're going to tell everybody and that it'll be fine.
Yeah.
Unfortunately, like you say, everybody says they're the best. I mean, first of all, you can look at the label to a degree. So for things like fillers, a lot of the time they're honest about it and they'll say, contains silica, contains magnesium stearate, contains all these things that you don't want to put in your body. But because of the laws, they don't have to put that in the supplement facts. So everybody looks at the supplement facts, but there's a little, in really, really small print somewhere, it will say other ingredients. That's the bit you should be looking at. If they don't make the supplement facts what the ingredients very obvious on the website, that's a red flag. A lot of it tends to be a lot of websites these days will just sort of focus on the benefits or so-called benefits instead of actually what's in there. Again, it's just about education and information from a consumer perspective. For me personally, I would be more extreme about it and I would say, what are you doing to advance the science? What are you doing to advance the longevity? What are you doing to test your own products in a clinical trial? And it doesn't even have to be randomized placebo control. Just get 200 people together, give them all your supplement and test A, B, and C on day one, and test again on day 100. Just even basic stuff. And the reason most of them won't do this is because they're not real companies. It's somebody that's good at marketing, making a website, and then putting a label on someone else's product. That's the vast majority of the supplement industry right now. And I think it's a travesty.
Difficult, yeah, to navigate.
Yeah.
Maybe to another point, in your opinion, what person discovery or idea in the longevity space gets less attention than it deserves?
I think, yeah, the state of the supplement industry is
Yeah.
definitely something that should be spoken about more and isn't because of those financial incentives. And again, back to the other point of the fact that aging is reversible. That's been proven. If there's one thing that all longevity experts agree on, it's that aging is reversible. And the only disagreements now are how we do it and why we do it and how much we do it and all those kind of things. The vast majority of people in the world still don't know that aging is reversible.
But I mean,
There's no
is
reason our body needs to erode and ultimately die.
but I mean, we don't actually know how to re- actually reverse aging long term yet. Like, we maybe know how to get, like, a couple more years, but, like,
Well,
like,
that's reversing aging then, isn't it?
yeah.
That is reversing aging. We can. We had this conversation actually on the set of the reversed longevity series.
Yes, yes,
I know you had Charles Mattox on as well. He was the guy
yeah.
that was orchestrating that whole thing, and obviously Professor Meyer was there as well as one of the experts. And I remember that conversation because there was a few slight disagreements in wording, but ultimately everybody there agreed that we already know that aging is reversible. No matter how you put it, how you what verbiage you use, aging is reversible, and that's already proven. There's nobody questioning that. Like you say, the only questions are how much we can do it right now and what ways we're doing it.
Okay, yes, yes. If you say to a limited degree, I agree. But we're not able to make people live for 200, 500 years right now. Like, we can't reverse it in that
No,
level.
no, we are
Not
not.
yet.
That's true. That's true. So we're not saying that, people can be immortal,
Yeah.
but what we are doing is saying that aging has been the first rung on the ladder is to prove, is it actually reversible? Yes, we've ticked that box. So we're now onto the next rung, which is how far can we stretch this, you know?
Yeah, yeah. Okay, I see. What, in your years of working in the longevity industry, what is like a counterintuitive thing that you learned about aging longevity? Maybe, yeah, something that you really didn't think of before, like except this point that we were talking right now, like an aha moment that you had.
Probably understanding the role of NAD. I think that was really important for me personally. Then I would also say how powerful supplements can be because of the only supplements I knew of growing up were sort of pretty basic. I started to get sick and my mum would give me vitamin C to help boost my immune system and so I thought that was sort of I thought there was a lot of limitations on that. And actually that's not true. And also drugs as well. I'm not a big proponent of pharmaceuticals and certainly not the pharmaceutical industry, but you can and we have repurposed drugs. I think metformin is probably the most well known in this industry to have different effects on the body than they were actually intended for.
Yeah. You, as you already said, you went to, you were a guest at the Reverse Longevity documentary with Charles
Yes.
Maddox in Costa Rica. Um, During that time being there, like, what are like some of your main takeaways?
Well, first of all, Costa Rica is beautiful. I'm traveling every few days to different countries to go and talk about longevity around the world. And, most of the time you're stuck in a big tall building and you don't always get to go to the middle of the jungle for it. So that was nice. But yeah, listen, it was a great week in Costa Rica. Saw some of my old friends, Professor Andrea Maya, Nick Angera, who I believe you should probably also speak to on your podcast, and made some new friends like Dr. Lovkin. I think it helped to reconfirm, that DoNotAge.org is the bridge between the scientists and the general public. And I see Reversed as a really good vehicle for that message because I don't know if you know the platform, but essentially there were two guests and we kind of follow their health journey loosely throughout the series. And then a bunch of experts and we were all having various conversations about different health and longevity topics. And that was the kind of theme that I could see throughout it was that what DoNotAge.org brings is that bridge of understanding. Because if somebody's talking to you and they're using words that you don't understand or really long words that make you feel stupid, then your brain kind of turns off and you're like, I don't want to think about that. And so what we try and do is make it sort of easy and understandable for everyone. And we were trying to do that the same thing for those guests as well.
Through your experience in longevity, what would you advise like a young driven individual that is coming up in the industry and is like, I want to make impact, I want to help the industry to progress? What advice would you give this person?
First of all, network. When I first started in this industry, not only did I not have a scientific background, but I knew that I needed a lot of people on board that, excuse me, did have that background. And I networked my way to building this health research organization, which now helps millions of people every day and has turned people's health journeys around. Um, and so, if I can do it, anybody can do it. All I was motivated. But yeah, network, vast majority of the professors and researchers and scientists in this industry will be happy to help you. We have far more researchers now that we work with than actually work for us. And I have an even bigger network above that that will help me on a personal level if I WhatsApp them or message them and we have a chat about things. They're not allowed to help me officially because maybe they have a contract with a pharma company or with a different supplement company or whatever. But the actual person themselves got into this industry for a reason. So I would recommend that you network. I mean, if you're asking the question because it's for yourself, then you're doing a good job by having this podcast because most of these professors and scientists they want to speak about the work they're doing. They want to get it out there. So you can get them on, which gives you the relationship with them. And then you can use that to maybe grow something fantastic yourself.
Yeah, 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 yeah. Definitely, this question is not self-interested, but of course, I also think it's valuable for people to know that want
Yeah.
to get into the industry. Mm, I know we only have like a couple of minutes left, but like I'm a bit curious about the founding story of do.age.org. If you say like you don't have an academic background and you kind of network your way into that, like how did it go?
Yeah. So essentially, like I say, I found out the original thing that happened was I wanted to get some NMN and resveratrol for myself. And the only reputable source online at the time was around about $2,000 for a month supply. And I didn't have $2,000. And so I figured, well, I can't be the only person with this problem. And if I'd already read the papers, I'd already done the translating the scientific paper into easy speak. And so I knew that these ingredients worked and that I wanted to use them for myself. And I figured, well, I'm not going to be, everybody suffers from aging. I'm not going to be the only person that has this problem. So there has to be a way to fix it. I was shocked that nobody had already done it. And so originally I was like, well, let's just create this, provide those ingredients at a reasonable price. And then when I got, because I didn't even know anything about how to make a supplement either. So part of the learning journey was how they're made. And this is when I started to learn about that and how badly it was being done. I mean, that was the whole revelation, right? And so I figured, look, I'm going to need scientists on board. I'm going to need this. I'm going to need that. And then when I spoke to those researchers and got them on board, they said we also have problem too. The problem we have is the funding. Sometimes we don't have enough funding because aging is not seen as a disease, which I think is another travesty. When we do get funding, it's usually from some government pot, and they'll say, "Here's a few $1 million, but you have to spend it on this." And where I was like, "Well, you're the expert. I'll just give you the few $1 million, and you spend it on whatever you think is necessary." And so that was when it became, after those conversations with those researchers, it became clear that we needed to be the full circle. So we help consumers by providing the best quality ingredients and only the things that actually work, which is important. And then we use the profits to help the researchers, and then that loop continues.
Yeah, if you say you give researchers just money for like I can't really imagine like you give them money to do what they think is the most important research, but how would that benefit you? Like it has to be at least connected to like one of the supplements that you're selling, right?
No, we recently funded a rapamycin study. For those that don't know, rapamycin is a drug. So we'll never, as a traditional health research organization that provides supplements, will never be able to provide or benefit from that. But, again, we're trying to do the right thing for the longevity industry rather than the right thing just for our bottom line. We're doing okay.
Yeah,
We can pay everybody's wages. We're doing lots of different studies about lots of different things all over the world. Whenever we fund an NMN study, we're not the only ones that provide NMN, right? There are other people that provide it.
of course.
I won't go into what I think of that, but the point is that, so when we're doing that, we're helping those other companies too. But we're not doing it for that. We're doing it because it's the right thing to do.
Okay. Yeah, I appreciate it a lot. I appreciate it a lot, Alan. Before we end it, is there any last thing you want to share with the people listening?
You should like this video and subscribe to Elias's podcast. There you
Thank you a
go.
lot, Alan. Yeah, I really enjoyed talking to you, and have a good afternoon. So this was my conversation with Alan Graves. I hope you enjoyed it as much as I did. Links to everything mentioned are in the description, and there's also a link to another interview that I did with a person in longevity. Maybe I put the one for Andrea Meyer, actually. Bye-bye.